Welcome to The Explainer. Today, we're diving into a medical drama that happens deep inside the human body. And it's a story where the most dangerous moment isn't the loud, violent struggle for air, but the quiet, eerie silence that comes right after.
See, we're talking about something called foreign body aspiration. And what makes it so unbelievably scary is that the real threat, the real danger, often begins the moment the coughing and gagging stops. That quiet can be a deadly illusion. You know the feeling. It starts with that universal moment of sheer panic, a sudden violent fit of coughing, choking, and gagging when something goes down the wrong pipe. That is your body's alarm system just blaring at full volume. Now, in medical terms, this is what's called foreign body aspiration. And that initial frantic coughing, that's your body's first and most powerful line of defense. It's a desperate, physical attempt to blast an intruder out before it can get lodged deeper and cause some really serious damage. So you might be wondering, who does this happen to the most? Well, when you look at the data, the story it tells is crystal clear. A staggering 75%, 3/4 of all cases, happen to kids under the age of 3. And it really just highlights this perfect storm of vulnerability, right? Toddlers explore the entire world with their mouths, but they just don't have those mature swallowing reflexes yet, or the molars they need to grind up food properly. And the types of objects, they tend to change with age too. For little kids, it's almost always small food items. Think nuts, seeds, things like that. For adults, it's more likely to be things like bones or, believe it or not, dental work, especially if other things like alcohol or a neurological condition are involved. And it's right after this initial crisis that the story takes its most dangerous turn. Okay, this is what's so fascinating and frankly so scary about all this. It's what happens after that initial terrifying choking episode seems to be over. This is where the real danger, the silent danger, begins. The whole event really plays out like a 3-act play. Act 1 is that violent, acute choking. Act 3 is all the long-term, chronic complications. But it's Act 2, that silent phase in the middle, that is by far the most treacherous part of the journey. So during this silent phase, the object is now stuck deep inside the airway. The body's reflexes just get exhausted and the coughing stops. And this creates a huge false sense of security for everyone, for parents, and as this quote points out, even for doctors. A huge sigh of relief, right? But meanwhile, that object is just sitting in there like a ticking time bomb. So if the patient seems completely fine, how on earth do doctors find this hidden threat? Well, the process is this incredible piece of medical detective work. Okay, so right off the bat, they hit a massive roadblock. The most common culprits, we're talking peanuts, seeds, organic stuff, are what's called radiolucent. And that's just a fancy way of saying that up to 92% of them are completely invisible on a normal X-ray. You just can't see the object. Because of that, doctors have to look for indirect clues. And a brilliant way to think about this comes from a pioneer in the field, Dr. Chevalier Jackson. He explained that at first, the object acts like a bypass valve. Air can still squeeze past it on the way in and on the way out, so the X-ray looks totally normal. But then, the tissue around the object starts to get irritated, and it swells up. And this can create what Jackson called a check valve. Just think of it like a one-way door. When the person breathes in, their airway expands just enough for air to sneak past the object. But when they breathe out, the airway tightens, sealing around the object and trapping that air inside the lung. And over time, that swelling can get so bad, it becomes a stop valve. The airway is now totally blocked. No air in, no air out. And the section of the lung behind that blockage eventually just collapses. And that is a clear sound on an X-ray that the medical rescue team needs to go in and go in now. So once they've located the problem, the next step is getting the object out. And this is a super high-stakes procedure. It demands incredible skill, meticulous planning, and a whole lot of precision. The tools they use for this job have come such a long way. It all started back in 1897 when a doctor named Gustav Killian made the first daring removal of a pork bone. Then Dr. Jackson came along and developed the lighted scope. And by the 1960s, Shigeto Ikeda introduced the flexible bronchoscope, which absolutely revolutionized the entire field. Now, some objects are uniquely dangerous. Take a dried bean, for example. Inside the warm, moist environment of a lung, it starts to soak up water and can swell to more than double its original size. This makes getting it out incredibly difficult, and it can even rupture the airway.
There's this one terrifying story of a boy who fell into a trailer full of soybeans and actually aspirated multiple beans, which then all swelled up inside his lungs. A successful extraction is like a perfectly planned military operation. The team has to know the object's exact size and shape. Sometimes they'll even practice the removal on a duplicate object beforehand. They've got to pick the perfect tools, coordinate every move with the whole team, and have backup plans ready for absolutely every possibility. So after all of that, after the detective work, the high-stakes procedure, what's the outcome? And what are the big lessons we should really be taking away from this whole thing? Well, here's the truly amazing part. The effectiveness of these modern techniques is it's astounding. When you look at large studies, the success rate for removing these objects is over 99%. It's an incredible testament to the skill and the technology that makes these rescues possible. But, and this is a huge but, that incredible success rate hinges on one thing: preparation. As this quote makes crystal clear, a poorly planned attempt without the right team and the right tools can quickly turn a manageable situation into a life-threatening disaster. Ultimately, the story of foreign body aspiration is just this powerful reminder that the moment of greatest danger isn't always the loudest one. Sometimes it's the silence that follows. So the most important tool we all have is awareness, knowing that even when the coughing stops, you still have to listen for the threat you can no longer hear.